Welcome to the fourth episode in our series of informative videos about treatments that we offer here at the practice. Today we're going to look at ways that we treat patients who suffer with dental phobia or anxiety. Now this is a really common issue for many people, which is really worrying because it can actually prevent people from seeking out the treatment that they need and actually attending their dental appointments, and this can lead to many major oral health problems. Now we're really proud to say that our practice is dental phobia certified, which means we're proven to provide a range of dedicated treatments for dental phobics and are completely up to date with the current professional training and latest technologies regarding these treatments. And now what we'll do is answer some of the commonly asked questions that we get about dental phobia and how we treat it here at the practice. So a lot of people with dental anxiety want to kind of know why they have this issue. You may be able to pinpoint yourself, if you suffer from dental anxiety, a specific reason why visits to the dentist make you anxious. However, some people are unsure of why these feelings are there and why they have them in the first place. Now there's many different reasons why people suffer from dental phobia. Some people may have had a bad experience with the dentist as a child and are still put off visiting the dentist when they're grown up. Others are put off by what they think of as horror stories that they may have heard from friends or colleagues about bad experiences that they'd had, and therefore unwilling to put themselves at risk of having the same experience. Other people simply don't like the lack of control that they experience whilst visiting the dentist, and this really puts them off. They feel that they're like helpless in the chair and they can't do anything to stop the dentist doing what they're doing whilst they're carrying out the surgery. To try and combat this, our dentists always talk to their patients during the procedure and let them know exactly what they're doing and why, and we find this really helps to put patients at ease. Unfortunately, we hear from a lot of people that actually say they're so nervous about going to the dentist that they just simply don't go and haven't been for many years. Unfortunately, this is the worst thing that you can do, is to stop going to your dental appointments, as this can lead to severe oral health problems and result in lengthy and potentially very painful and expensive surgery. The longer that dental issues are left, the worse they will get, like with anything, and the more invasive treatment that you'll actually then need to have. And it may lead to even you losing your teeth, which is never good. We always encourage our patients to talk to us about their anxieties and worries, and we welcome prospective patients to visit the practice beforehand, meet the dentist and talk to them about the procedure to get a feel for the dentist and for the surgery itself. And this will be a much better option than just putting off going altogether. So a lot of our patients who are particularly nervous will ask us, what can we do to help them relax during their treatment? So we encourage our patients to let us know straight away if they're nervous about their procedure, and we'll do whatever we can in any way possible to help the patient feel relaxed. So for example, we can play soothing and relaxing music to help patients be put at ease while they're receiving the treatment, or patients can actually pick their favourite music that they like that makes them feel better. We also have like TV screens in the ceiling which the patients can watch. These are above the chair, so the patient can choose something of their choice that they really like watching, and that will help to take their mind off the procedure. We'll also talk to our patients every step of the way, which we find really helps to try and take their mind off the surgery and inform them in detail about everything that is happening. The dentists also let their patients take as many breaks as possible during their treatments. They just need to raise their hand to let the dentist know that they need to take a break, and then they can have one. So breaking up the treatments in this way also really helps the patient to feel more relaxed. We're more than used to treating patients who suffer from dental phobia and are fully trained to help. And we're more than happy to help as well. But it's really important that you let us know if you are apprehensive so that we can actually prepare for your visit. We've treated many patients who are nervous about visiting us, and you will be nowhere near the worst case that we've ever encountered. And no matter how much inconvenience you think you might be causing the dentist, it's so important to remember that your oral health comes first and that he or she is trained to help those patients feel comfortable during dental procedures. The dentist will in no way feel that the patient is causing them any inconvenience or wasting their time. They're basically just doing their job. And you should never ever be embarrassed about suffering from dental phobia either, and never let it put you off attending an appointment. We'd rather spend more time with you at your appointment than you to avoid an appointment and therefore your oral health to suffer. Now, at this practice, all of our dentists are trained in the gentle dentistry approach. They have access to vast amounts of training and knowledge about how to treat patients who are anxious about pain or phobic about dentistry. They're fully equipped and able to employ sophisticated behavioural management techniques, which help our patients to relax. All of our dentists are highly skilled and completely sensitive to how their patients are feeling. So they are able to adjust their own behaviour and approach to suit different patients and put them at ease. For example, if you need injections, the less tension in your body, then the easier and less painful those injections will be. So our primary goal, first and foremost, is to make our patients feel welcome, calm and relaxed as soon as they walk through the door. Therefore, we have made the practice wonderfully welcoming. Our staff will always greet you with a smile and even have a massage chair in the reception area to make patients feel more relaxed whilst they're waiting for treatment. We also offer hot and cold drinks and have a wealth of literature available to help patients sort of take their mind off what's going to be happening. And this kind of really helps anxious patients to stop them thinking about what's going to be happening next and actually to help put them in a relaxed state. If our patients are so anxious that they can't even bear to wait in the waiting room, then there's another option for them. They can request to be brought straight through to the surgery. So whatever the request to help ease the anxiety, we will fulfill it and make sure that none of our patients feel really, really nervous before attending appointments here. Okay, so lots of people tell us they're scared of the treatment actually being painful and ask us if we can do anything to make it less painful. The first thing we can do, which is quite basic but really helps, is to apply a numbing gel, which is basically just topical anaesthesia. If you're phobic about dental pain or about needles, about the injection, the dentist can apply the numbing gel to the gums before they actually put the injection in. This helps to reduce the pain of the needle as it enters the tissue. The numbing gel helps patients to feel relaxed and feel more comfortable about facing a needle and removes any pain at the same time. We also offer what is called the dental wand. Now these are really, really good because they offer a pain-free injection of local anaesthetic. So a lot of fear about the dentist actually comes from people's fear of needles. So we find that if we offer a pain-free injection, this actually puts a lot of people at ease because they know they're not going to have to go through that initial pain of having the injection put in. The flow of anaesthetic in the wand, it's computer controlled. Now often the pain that comes from the injection is from the anaesthetic being injected too quickly or a bit erratically. So basically the wand operates with the computer controlled system and it removes the possibility of the injection being delivered accidentally fast. So this actually does offer a completely pain-free injection. And then after this point, your mouth is numbed up anyway, so you won't feel the treatment. So this tends to reduce a lot of patients' anxiety. So another really common question we get asked is, can patients be sedated for their treatment? So yes, we do offer sedation dentistry here at the practice, and this basically uses medication to put the patient into a really relaxed, dreamlike state whilst having the surgery carried out. So this means that the patient doesn't feel the stress and anxiety that they usually feel prior to visiting the dentist and the dental procedure taking place. For the dentist, sedation is also a really good thing because it means that the surgery is actually easier to perform because the patient is a lot more relaxed in the chair. So more surgery can actually be completed in one session, which reduces the number of sessions that are actually needed to carry out the course of treatment. So there's lots and lots of benefits to this. It's a really ideal solution to those people who suffer from dental phobia, and it's used here regularly to perform surgery on patients in a stress and worry-free way, and helps many patients to overcome their fear of visiting the dentist, which is a really, really good thing. Sedation dentistry actually comes in many forms, so you can have oral sedation, inhalation to sedation, or intravenous sedation. And it's important for you to remember that sedation, it doesn't mean to be put to sleep like a general anaesthetic. It's only a part of it. So sedation techniques will make you feel drowsy, but are different from general anaesthetics, which may actually last for hours and have like complicated side effects as well, and actually, you know, put you into that full-on deep sleep. So sedation dentistry is a fantastic solution for many sufferers, but not everybody is suited to it. So there is that kind of downside as well. Those who are already taking some sort of medication must alert the dentist before taking oral sedatives. And we'd need to know if you're allergic to anything. So we'd need to perform like a full medical history before we could actually offer you sedation. And there is an additional charge for this treatment as well. Really common thing with people who are phobic of the dentist is that they hate the sound and the feel of a drill, and they ask us if there's an alternative treatment to this. So a lot of people can't think of the dentist without imagining the sound of a drill. This is because whether preparing a tooth for a crown, removing cavities, which are the holes that you get from decay, or performing root canal therapy, dentists have actually relied on this time-tested technology for many, many years. However, modern dentists, such as the dentist here, we also have a newer option for removing tiny portions of the tooth structure without that familiar noise of a drill, and this is called air abrasion. So patients who feel some level of dental anxiety at the thought of a traditional drill would actually be pleasantly surprised to discover that air abrasion is an alternative to drills, and it's available for many, many procedures. So compared with the traditional drilling method, there's lots of advantages. So it generates no heat or pressure or vibration. So this is welcome news to people who cannot stand the dental drill. It also sometimes reduces the need for anaesthetics, especially if the cavity is quite shallow. And the procedure is pretty simple, although it may take slightly longer than traditional drilling. So it's going to take away the kind of anxiety that's felt around, you know, the drill, but it's not necessarily going to be completely free of pain. So it's important that patients remember that. And it can't be used for really deep cavities or for cavities in between the teeth. So it's best for removing really small cavities that form early on the outer or chewing surface of the teeth. So it can't be used for anything deeper than that. If hard enamel needs to be removed to access the decay, this also can't be done with air abrasion, and a traditional drill must be used. And also crowns, onlays and inlays can't be prepared using air abrasion. So it can't be used for all treatments. But the good news is it can be used for a lot of treatments. So it's always worth asking if that can be used for your procedure, particularly if you really hate the drill. Our practice could not be further from traditional dentists from many years ago. We're completely modern, and we try really hard to eliminate the smells of old school dentistry and the stigma that's attached to it as well. Dentists are now much more aware of the needs and feelings of their patients, which, you know, is a really good thing. We totally embrace this ethos, and the happiness and well-being of our patients is at basically the heart of everything that we do. And we do everything in our power to make our patients feel comfortable and cared for, and we encourage them to talk openly and honestly about concerns or apprehensions that they have, and we listen to those wholeheartedly and take them on board. And we like to think, therefore, that every patient that comes to us, to this practice, feels relaxed and really, really well looked after. Now, if you have any further questions or unclear about anything that I've said, or you want to discuss anything in more detail to do with dental phobia, please don't hesitate to contact the practice. We'd be more than happy to help. And if you are a nervous patient, feel free to contact us to arrange a visit to the practice if you would like to come and see us before you actually start any kind of treatment. We completely welcome this. So yeah, please don't hesitate to give us a call. So our next video is going to be on tooth whitening, because obviously this is, you know, really popular treatment at the moment and lots of people ask us questions about it. So this is going to be posted in the next couple of weeks, so keep your eye out and I'll see you then. Thank you.